penile implant isn't for everyone. We typically reserve this surgery for men that have failed oral medicines like Viagra, Cialis, Levitra, Stendra, Staxin, or men with a bend in their penis that also happen to have erectile dysfunction. One of the best things about the penile implant is that it's covered by almost all insurances. This includes Medicare. There are two basic types of penile implants. You have your malleable rods, which are bendable implants with no actual mechanism to them. There's no inflation, there's no deflation mechanism to it. And then you have your inflatable device. These are the ones that you can pump up, keep up as long as you want, and then bring down, giving you full control of your erections. Both the malleable and the inflatable implant are great implants. Think of the malleable as the Toyota of penile implants. It's dependable, it's reliable, it works. It's an implant that's inserted, and the best thing about it is it's always up and it's always ready to go. Of course, the worst thing about it is it's always up and it's always ready to go. On the flip side, you have your inflatable implant. This is more like the Lexus of penile implants. It has more gadgets to it. It has more of a mechanism to it. You can inflate it, you can deflate it, you can keep it up for as long as you want, you can bring it down whenever you want. And this one really gives you the most control of your erections. The inflatable penile implant has 4 pieces to it. There are 2 cylinders that go inside the penis. There is a storage pouch called a reservoir that goes in this natural space in your pelvis called the spacer retius. And then there's a button or a pump that hides inside your scrotum. All of this is internal, you can't see any of it. And whenever you want to give yourself an erection, you simply squeeze that pump in the scrotum, inflate the device. You can keep it up for as long as you want, you can have sex for as long as you want, and you can bring it down whenever you want. The release button to bring it down is also attached to that pump. You simply squeeze that button, you give the penis a little squeeze, and your erection will come down. One of the best things about the penile implant is that it really doesn't affect your ejaculation or your orgasms or sensation. All it really does is give you a great erection that you have full control over. Your ejaculation, your orgasm, the sensation, and your ability to have all of that stays exactly the same as it was before surgery. Now, if you've had a prior prostate surgery and you're unable to ejaculate, that doesn't change. But the penile implant surgery itself does not impact these 2 things. The penile implant itself is made out of a material called Bioflex. It's safe, does not degrade inside your body, and inside of this Bioflex material, we put saline solution or just salt water. It's safe. If for some reason there's a break in the implant or the water leaks out or the fluid leaks out, it's non-harmful. This surgery can be done in the hospital or in the surgery center. It's extremely safe. When you come in, you get IV antibiotics. We take you back to the operating room. We give you general anesthesia. After you get general anesthesia, you're going to get a local block. And what this will do is reduce your recovery pain. We then do a special wash and a special prep. And we do take all of these measures to reduce the infection risk to under 1%. We then make a small incision, about 2 to 3 centimeters in size. This is typically down in the scrotum. We then put in all the pieces of the penile implant. We make a small tunnel where the cylinders will go. We put the reservoir down in the pelvis, and we put a pump or the button that you squeeze in order to get an erection down in the scrotum. I take I'm extremely efficient. I do the surgery in about 30 minutes. But I take the time that's needed to make sure you have the best sized implant for you. I know size matters, and so I take the care to give you the longest and strongest implant that you can accommodate. It's an extremely quick recovery. Most people in the nation will tell you it is 6 to 8 weeks. Our recovery is about 3 to 4 weeks before you're ready to use it. And that's because we make a very small incision, only about 2 to 3 centimeters. We take the extra care where it's needed. We make sure that you're counseled on icing and using a tight scrotal support. We give you a block which decreases pain and that encourages healing. And we get you up and moving as quickly as possible. I typically expect this implant to last about 10 to 15 years. The data shows about 88% of penile implants are still going strong at 10 years. But sometimes they break down sooner. They may break down at 1 year, at 5 years, at 10 years, 15 years, or 20 years. If it breaks down sooner, then we just simply take it out, wash everything out, and swap it out for a new one. One of the best things about the penile implant is the satisfaction rate. The satisfaction rate for meds and really for any other treatment is about 50% or less. And the success rates for many of these are about that amount. For the penile implant, the success rates are close to 100% once you've healed. And the satisfaction rates are right around there. They're about 94% for patients and even higher than that for partners. The penile implant has the typical risks that you see with any surgery that you have done. Risks of infection, risks of bleeding, risks of anesthesia. You have to be able to wake up from the anesthesia, and that's why we have a cardiologist evaluate you and make sure that your heart is strong enough to undergo it. And risks specific to the penile implant include a 1 to 3% risk of infection, the risk that the prosthetic can find its way outside the body. We call that an erosion. It's rare, but it can happen. And of course, a risk that surrounding organs like the tube that you pee out of called the urethra or the testicles that are nearby can get injured. I'll tell you that overall, it's a very, very safe surgery. These things are very rare. About 97 to 99% of patients have no issues whatsoever. And my expectation is that you'll be one of those patients. Most men that have gotten to this point in their treatment have failed prior medications. They may have failed injection therapy or have had an inability to tolerate the injection therapy. They may have failed urethral gels. They may have not tolerated a vacuum erection device. You may have a bend in your penis. You may have pain when you have erections because of Peyronie's disease. Whatever the reason is, you should know that at this point you're here for a reason and you're in good hands. When you come in for your surgery, the first thing you'll do is you'll change into a gown and you'll get IV antibiotics. After you get IV antibiotics, you'll get taken to the operating room and you'll lay down on a table. You'll get some general anesthesia. We'll then do a special wash and a prep to decrease your risk of infections. I give you a special block. What the block does is it numbs your local nerves so that you have a pain-free experience when you wake up. I then proceed to make a small cut about that big in the scrotum. I put in all 4 pieces of the implant, the 2 cylinders that go inside the penis, the little balloon called the reservoir that goes in this natural space in your pelvis, and a pump down in the scrotum that's going to allow you to control your erections. I then close the skin with stitches that are going to dissolve on their own, and you're taken back to the PACU area to start the waking up and healing process. The surgery itself only takes 30 to 40 minutes. But when you come in, you're going to get a gown to change into, you're going to get IV antibiotics, you're going to get taken back to the operating room. I'm going to spend time doing a wash and a block to decrease your infection risk and to improve your post-op recovery. After the surgery, you're going to get taken back after you're awoken. I'm going to make sure that you're able to empty your bladder. I'm going to make sure that your pain is controlled and that when you leave my surgery center, you're going to leave in the safest conditions possible. All of this takes about 4 hours, so you can expect about a 4-hour day. We get clearances because we want to make sure that you have an awesome recovery. We want to make sure that when we give you anesthesia, your heart, your lungs are able to wake up from it. If you have a previous heart problem, if you have diabetes, which is a risk factor for heart disease, or even just erectile dysfunction in general, which is a risk factor for heart disease, we typically get at least a cardiac or heart evaluation. If you have lung issues, we may get a pulmonary evaluation. If you have kidney issues, sometimes we'll get a nephrology evaluation. These evaluations are important, and the clearances are what allow us to confidently say you're going to recover well. It's important you bring someone with you to drop you off and pick you up. Anesthesia does funny things to you. It can make you drowsy afterwards. It can cause what we call retrograde amnesia, where for a short period of time you may not remember what happened. And for this reason, not only do we recommend you have someone who you know and trust take you home, but we recommend someone be there for the first 24 hours while the anesthesia is wearing off. I see most patients back before the surgery, typically about 2 to 3 weeks before. At that time, I make sure all your clearances are in. I make sure that you don't have any additional questions. I make sure that there are no infections that I'm worried about. But just as importantly, it's when I go over details like this. I give you an antibiotic wash that I want you to start using about 3 days before the surgery. And that means that you have to use it and wash the genital area every day for 3 days, including the day of the surgery. We also discuss things like a vacuum erection device if you're concerned about a penile length and maybe loss of penile length up until this point. Then I encourage you to start using a vacuum erection device for 10 minutes twice a day up until the day of surgery. We typically encourage that you take all your home medications. The exception to this rule are blood thinners. These are medications like aspirin, Plavix, Xarelto, or any medication that can thin your blood. Also included in this category are NSAIDs, medications like ibuprofen or Motrin. These medications increase your propensity to bleed and can increase your bleeding after the surgery. We depend on your cardiologist or your primary care doctor or your vascular surgeon, or really whoever is managing your blood thinners, to guide us on how long you should stop your blood thinners before the surgery. This is a great question. You should not eat or drink anything after midnight the night before. We sometimes allow clear liquids that you can take up until 6 a.m. the morning of surgery. Our pre-op team will call you in advance and discuss some of these things with you. On the day of surgery, there's not much you need to bring. I would bring just a pair of comfortable, loose-fitting pants to wear. But at home, I would keep a couple pairs of tight jock straps or tight underwear or tight bicycle shorts. I would keep ice packs or frozen bags of peas or something that you can regularly ice with. I would make sure that I have a ride on the day of surgery so that you can get home safely. A question that's commonly asked is, should I shave before surgery? We generally don't recommend shaving before surgery. Most of the grooming we'll take care of at the time of surgery. But if you groom regularly, then we recommend stopping grooming within 2 weeks of the surgery. Getting cold feet is a common thing before any surgery, and this surgery is no different. And so there are a lot of things that I'll encourage you to do leading up to the surgery. I encourage you to talk to our patient educators who have gone through the surgery. They can tell you what to expect and what the post-op recovery is going to be like. I encourage you to ask me any questions that you have. And for this reason, I'm always available, but just as importantly, I schedule that pre-op visit. It's a visit about 2 to 3 weeks before surgery, and it gives you an opportunity to ask all the questions that you have come up with up until that point. As you lead up to the surgery, you're gonna come up with new questions. This is why I have an appointment waiting for you to release those questions. But in the meantime, you also have opportunities to call our patient educators who have gone through the surgery. And of course, you can always reach out to me if you're just dying to know the answer to one of your questions. One of the unique things that I do in my surgeries is I give you what we call a local penile block. What that means is I block the nerves to the penis and the scrotum. What this provides is a pain-free experience immediately after the surgery, and the block typically lasts about 2 to 3 days. In the event that you have some additional pain needs, I do give you oral pain medications. And these medications are typically needed for about 10 to 14 days. There are several things that I rely on you to do to improve your recovery. I expect you to ice your scrotum as much as you can after the surgery. I expect you to wear tight scrotal support, and this includes a jock strap, bike shorts, which are my favorite, or any kind of tight compressive underwear. And the reason you do this is it'll reduce your swelling and improve your healing, and it'll expedite how quickly you'll recover. For the most part, I just want you to leave the incision site alone. You don't have to pick at it if it has glue. If there's stitches there, I don't want you to touch them. You'll have a drain, which I want you to take out about 2 days after surgery. And 2 days after that, I want you to start showering. Until then, you can just dab the area with a wet cloth. Once you start showering, you can dab soap and water on the area and dab it dry. But the most important thing is leave the incision alone and don't pick at it. As your swelling goes down, you'll start noticing a very mild bulge in the scrotum, and that is probably your pump. Whenever the soreness has gone down enough where you can grab it or hold it, I want you to start gently pulling it down. The easiest way to do it is when you're in the shower. Let warm water run down, and during that time, pull the pump down and hold it down for about 90 seconds. This is your opportunity to get the pump in the location that you want it. As I mentioned before, one of the things I do to reduce your pain is give you a local anesthesia. By giving you a local block, that reduces your needs for pain meds. If the pain is low enough where you can just simply take ibuprofen or Tylenol, then I encourage you to do that because it reduces or eliminates constipation. If you need the pain meds that I gave you, then I encourage you to take Colace or some sort of stool softener with it to reduce the possibility of constipation. You definitely want to avoid heavy lifting after surgery. Heavy lifting can increase pressure down in your scrotum, and that can result in increased risk of bleeding or breakdown of some of the sutures that were placed in there. I would also avoid showering until 2 days after the drain is removed. And the reason for that is because you have a small hole where the drain was sitting, and if you shower too early, that can allow non-sterile water to get into the area where the prosthetic is sitting. We typically recommend you avoid driving for 24 hours after you received anesthesia. If you're not requiring the oral opioid pain medications, then you can start driving immediately after that period. If you're taking opioids, we recommend you avoid driving. You can return to work typically after about 2 weeks. That includes light activity. If you do heavy lifting for work, then we certainly recommend you wait until 4 to 6 weeks after surgery. Most people will tell you that the recovery period for this type of surgery is about 6 to 8 weeks. For my patients, the recovery is more like 3 to 4 weeks. And so that means in 3 to 4 weeks from the time of surgery, you're ready to use it. The reason is because I make a very small incision, only about 2 to 3 centimeters. We limit the amount of manipulation you need to do, and we do the surgery as efficiently and quickly as possible. And on your end, what this allows you to do is recover quicker and start using it quicker. A common phone call that I get after surgery is, "Hey doc, everything looks swollen and bruised. Is this normal?" That can be normal, and typically all that means is you just haven't iced it enough and you're not wearing tight enough compressive shorts. Bruising and swelling are a normal post-op recovery course. But what is abnormal is redness, if everything looks red and beefy, if there's drainage that looks more like white, chalky material, if you're having fevers, or if you're having significant burning or bleeding when you urinate. In those settings, that I absolutely want you to call me and let me know. Your post-op recovery follow-ups go as such. Typically, about 2 to 5 days after your surgery, you'll come in to have your drain removed. If you had difficulty emptying your bladder after the surgery, then you'll have your Foley catheter or bladder catheter removed at that same time. After that, I just want you to heal. I typically don't see you until 3 to 4 weeks after the surgery. When you come in at your 3 to 4 week appointment, that's when we start talking about inflating, deflating, and you start learning how to use the implant. On that day, you're actually ready to use it, and you can actually go home and start practicing. As you recover from your surgery, more questions are going to come up. I'm, of course, always available for those questions, and of course, you'll have ample opportunity to come in and talk to me in person. You'll have contact numbers for patient educators who have gone through the surgery. And those are a great resource for you to take advantage of and call. They've been through the recovery process. They can tell you whether what you're going through is normal or not. If you have any concerns, of course, I always want you to reach out to me.